My name is Alexis and I'm doing a presentation today on muscular dystrophy. I had no idea before researching for this presentation that there are so many different types of muscular dystrophy, but I soon learned that muscular dystrophy really just means that it's a group of diseases that are caused by weakening muscles progressively over time due to the loss of muscle mass. And the etiology behind muscular dystrophy, it's just really that muscular dystrophy, there's a certain type of gene that are involved in making proteins that protect the muscle fibers. And muscular dystrophy occurs when one is defective. Each form of muscular dystrophy is caused by a genetic mutation particular to that type of disease. All these different types of muscular dystrophy diseases. Most of these mutations are inherited. So then the pathophysiology behind muscular dystrophy, it's caused by the progressive loss of the muscles' contractility due to the destruction of the myofibrils, the lack of dystrophin proteins in the cell membrane, and this is going to cause your muscle cell necrosis, okay? So then the rate of the myofibril destruction varies among these different types of muscular dystrophies, okay? So I'll go ahead and get these down and I'll go ahead and show you the different types. So the first type of muscular dystrophy, I do some little guys here. The first type of muscular dystrophy we have, it's the Duchenne type of muscular dystrophy. And this type, the black that's colored here, that's where I try to represent the muscle weakness that the patient might be experiencing. And this is representing Becker's and Duchenne. So for Duchenne, the X-linked recessive inherited condition, it affects only males. It's most severe and the most common. Symptoms appear 5 years, between 5 and he or she could have it at 2 years, but symptoms might not be there. At 5 years, symptoms appear, and by 12 years, they're in a wheelchair. But the lifespan of these patients normally only make it to 20 years. Manifestations of these patients might be large calves, waddling gait, increased falls, inability to run or jump, and then 90% have a valley sign, and that's just where they have a depressed auxiliary fold, and they can be seen when patients abduct shoulders at 90-degree elbows, and then they flex at 90 degrees. And then patterns of muscle weakness is always bilateral and symmetrical, and then it progresses from proximal to distal, and then it affects from the bottom before it affects to the top. So that's for Duchenne. And then for the Becker's type, which again, it's the same type of muscles affected. It's the second most common, only males. Symptoms occur between 6 and 18 years. It's weakness in the pelvic muscles, then shoulders, then back. Delayed amputation, difficulty climbing stairs, toe walking, and cramps. You might have some fatigue, and lifespan can be long and active, and patients don't necessarily need to be in a wheelchair. They can avoid wheelchair if they do if they treat it appropriately and they do the life considerations so that way they can flourish in life and that they're able to live a long, healthy life, and they do the things needed and exercise and do everything medication-wise and everything to live a long, healthy life. They can avoid that wheelchair. Just everyone is so different. But patterns of muscle weakness, they are symmetrical, and they're starting with the pelvic girdle, thighs, and then it goes to the trunk. Then you have your upper extremities, and then but no facial muscles are really affected by this one. And then you move over here to your Emery and diffuse type, and again, these black little areas, I kind of, it's a little bit uneven here, but it is less common type. Boys are normally affected, and it has a significant cardiac complication with this type. And this is less common, generally only affects boys. And muscles, contractures appear first in the heels, then it goes quads, elbows, and posterior neck. And then, like I said, it has that cardiac complication. Then we go over here to the limb girdle type, and this is the boys and girls, both can have it. It has a positive Gower sign. So this is when a child might, it normally gets diagnosed between 8 and 15, and the child might press on his legs to try to sturdy himself and help stand up, and then it might get to where he's pressing his legs to stand whatsoever, not just to stand up, but like get from floor standing up to like help him stand up, but like to physically keep standing, and then where he just can't physically stand anymore at all. So it's like kind of like a circle, and just he just goes from standing normal to, it's actually this picture. I'll go ahead and show you. My ink kind of faded out. You can kind of see it. It's like this little picture here. But that is the goer sign. And so back here with the limb and girdle, it's the pelvis, shoulders, and back, hard time pushing things, hypotonia, so it's abnormal weak muscle tone, poor head control, dislocated hips, tightness in ankles, hips, knees, and elbows. And then you might also have some stumbling, waddling, toe walking, difficulty on stairs because you do have all that toe walking and everything. And then you might have some heart problems and difficulty breathing as well, maybe some difficulty swallowing because of all that head control. So you just want to watch out with those patients. And then you have the fascioscapulohumeral type, and that's the third most common type. Males and females are both affected. And then it is all of these like areas of color, including the face. It's just not a really big smiley face. There is a reason for that. So I'll put that right there. It initially affects the facial and shoulder and upper arms. And it's a symmetry of smiling. So it's the mouth. So whenever the patient smiles, the patient, like it's an overreactive smile kind of thing. But the patient cannot pucker or whistle. The patient pretty much just smiles, and it's a kind of like a neat little thing. But it's the third most common type, and it's a weakness in the face muscles. And it often can lead to drooling. They don't really have control over their face muscles. But they can't pucker and they can't whistle, so they can't really, they kind of have like a droopy side. I said over smiling, but I kind of meant like a little droopy side. It's not a symmetrical smile is what I meant. Then you have an oculoparyngeal type, and that's a rare genetic, slowly progressive, and it might cause myopathy, and this happens between 40 and 60 years old. And I drew some, it looks like little glasses here, but it generally affects the face. Like I said, it's rare, it's genetic, slowly progressive myopathy. It's upper eyelid, and this might also affect the throat and also the pelvic, shoulders, legs, and arms, and it might have difficulty swallowing because, again, we mess with those throat muscles. And then also not pictured on here for the drawing, I have the congenital, and that affects both the girls and boys, and it's apparent at birth, and then it also could be seen at 2 years old if you don't get it at birth. And then there are some patients that might appear in later in life because they just didn't get it at birth and stuff, and it was just mild. And then you have myotonic, and this is rare, and that's whenever you have a long face and long neck, droop eyelids, swallowing issues, hands and feet are both affected, muscles are unable to relax. Infants might appear a little bit floppy and slow development. Teens and adults, whenever it onsets. Males and females are both affected, and 50% live over the age of 50. So diagnosis and testing, you have clinical presentation. So this might just be like the patient, how they appear with all these different types that I said. They might appear with, like, the droopy eyes, the muscle weakness, that kind of thing. Family history, EMG, you might also have a nerve conduction study test, biopsies, some lab tests like creatinine kinase might be elevated, and then your DNA analysis, so you might have a genetic testing done. And then for the Dutching and the Becker's test, muscle biopsies may be done to see if your muscle protein levels and everything are down. And then where the muscular dystrophy is genetic, there is nothing to prevent these from getting, there's nothing to prevent these patients from getting this disease, but there's nothing we can do but to help them live a healthy life and try to treat them as best as we can with the steroid medications and other type of medications, physical therapy, breathing aids, splints, physical therapy. But like I said, it's incurable, and the lifetime is often short, unfortunately. We just need to try to help them exercise, do what the doctor says, go to the doctor's appointments, and live their life the best they can. Hey guys, I just had 2 questions for everybody to make sure you guys were paying attention during the presentation. Which type of sign indicates that the patient has the limb-girdle sign? That is the Gower sign. And also, which type of muscular dystrophy are we able to detect at birth? That is congenital muscular dystrophy.